10-20 years, I observed that there are increasing demand from policymakers for evidence. Gradually, I think it's an interaction between the demand for evidence and supply of evidence. I would think that the supply side comes first.
So one important thing is to have a consistent, comprehensive, longer-term policy, and that's only possible if you have the necessary evidence to help you, to enable you to design the framework for a longer-term policy, for particularly sector strengthening. So that requires a very close collaboration with the institutes that are engaged in policy research, in action research, in generating data, in information management. Now, many a time, one of the major problems also is in these countries, you do not have such institutions because policy is not necessarily based on evidence, so there's no demand, and also perhaps there's no capacity to generate that. So what happens then is you're really operating in a vacuum, or you're operating on an ad hoc information as and when it emerges. So that's why it becomes very important, number one, to also support such institutions and to develop their capacities, develop their own systems, and to see them as an integral part of policy making.
Yeah, the role of health policy research institutes are very important because if there is an institute, there is a credibility, sustainability, and the training aspect also happens in these institutes. So the sustainability issue can be addressed only because of these institutes, because people keep changing, but there are certain people who will be bridging that gap between one generation to another.
The report started out by trying to sketch out how many of these institutes there were and where they were located, and we were really interested in low and middle income countries, not so much the high income countries. And there's no kind of established database, but from what we found, about 78 scattered across the world, particularly in Asia. And there's quite a mix, both in terms of the countries where they're situated, but also in terms of their sort of institutional affiliations.
IHS emerged very spontaneously out of the need for health system research. During the course of my work as Registrar of the University of Health Sciences or Commissioner of Medical Services, and in these postings I realized that there are many operations research that needed to be done. We looked around for academicians who could do some health system research to address specific operational issues that were bothering us, and we didn't find anyone. As a result, IHS had to be set up. For example, availability of doctors is a key concern of policymakers today, both in Andhra Pradesh and all over India, and it is true also for most developing countries. And the Institute of Health System is currently doing a project which is funded by the state government to measure availability of doctors in primary health centers.
The main role of IHPP is to produce good evidence by conducting policy relevant research. Second is to translate all this evidence into policy by whatever mechanism we have, multiple mechanisms. Third, build up capacity of young people, young generation. Fourth mission is to ensure networking within the countries, networking in the region and outside region. After the economic crisis in 1997, Director Vichan Panit challenged me. He met me and told me that he was assigned by the board for the research, senior research scholar, SRS in health financing. Please draft a proposal to Thailand Research Fund. I asked him what I should do. He said, build up capacity in health financing, full stop. By what? By doing policy relevant research.
Most important concern that we provide evidence for the policy development that is mainly responded by MOS. That's why all our activity have to have a very good links and in on track with the policy from government as well as the MOS. In fact, we have 7 departments, but you know the health system is a system. So even we divided into different different aspects of the health system. When we conduct a study, we have very good link between the department, and we can support each other.
It's project for strengthening, yes, capacity of our researchers is very important. But in basing on the strengthening of the capacity, we can give some output, that is information for making the policy. So with this project, we can train the researchers, but at the end of the project, we have some result that help us to make a policy.
One important lesson I learnt is that to sustain an institution like this, purely unsponsored research needs very high quality faculty. And it's extremely difficult for a new institution to gather all these faculty and retain them. Unless you have high quality faculty, you won't have skills to design new proposals, seek out funding. And if you don't have funding, you can't recruit faculty. It's a chicken and egg problem.
These institutes are often placed in a kind of tricky middle position between government on the one hand and being sort of full research organisations on the other. And how they manage that relationship so that they're close to government, they can influence government, and yet at the same time they're able to do rigorous and independent analysis, and trying to find that seam, that balance is really important.
Most critical part is human resource researcher.
We mainly focus on 3 goods. The one is good at brain. Another one is good at heart. The third one is good at hand. Good at brain, that we would love to have the very high level of the people who are very good to think about have a conceptual framework. Good at hand means that they can produce work quickly, efficiently, and in the good quality of work. Good at heart, we have to see them for a long time in order to know that whether they are committed to work with the public health sector or not. Because in our institute, we focus on the public interest, not the private sector. Yeah.
I think that I am very proud about of my institutes, but what I need is training for researchers, and how to react in time with the order coming from the minister.
The other thing that came out really strongly was really about the role of leadership and human resources in these institutions, or at least institutes. And although I think having skilled human resources at every level is important, what seemed really, really critical is having the leaders who had the credibility to engage with government and policymakers, to engage at high levels with civil society organisations and other groups who might use evidence from a Health Policy Analysis Institute. But also that kind of leadership played an absolutely critical role in mentoring and supporting more junior staff.
So first, choose the right person, and not only one, it has to be collective leadership. Second, continuity. If you choose the right person, and he, after 2 or 3 years, he is in the hierarchy, he moves from this to that all the time, you lose. There is no continuity of wisdom, continuity of leadership, continuity of network and connection. The key is that this institute provide an environment to nurture, to build up individual capacity to do health policy, health system research, and provide a network like a community of people. But if you are working together, you can do more.